Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for returning for another segment. We're going to be speaking with Emily Goetz in this segment, VP of Commercial at Bright.md. It's an asynchronous virtual care platform. She's joining us to discuss misconceptions around asynchronous telehealth and elaborate on how asynchronous care options can help address some of the major challenges that healthcare organizations currently face. Challenges such as workforce shortages, consumerization of care, patient access, and a lot more. Welcome to Health Professional Radio. Emily Goetz, thank you so much for taking the time.
Hi, Neil. Thanks for having me. I'm excited to be here.
Well, what is your professional background? What is your area of expertise? And talk a bit about Bright.md.
Yeah, so my background's actually outside of healthcare. Until I joined Bright.md, I was purely a patient. But my background is really in technology companies, and it's been specifically focused in these kind of startup growth companies that I think have the potential to really transform, particularly enterprise workflows. And that's a little bit about what Bright.md does too, because asynchronous care, what we do, helps a provider treat a patient virtually without that face-to-face traditional real-time interaction. And so what we're really helping health systems do is rethink how they're doing their workflows and how they're kind of interacting with a patient on common low acuity conditions, things like cold, cough, flu, rashes, pink eye, ear pain, and even things like behavioral health.
Asynchronous care, what exactly is it? And you described it a bit, but how does it differ from other care models? We're not talking telehealth here, are we?
Yeah, so it's a telehealth, but probably not in the way we're thinking about it. When I think of telehealth, before I started at Bright.md, of course, I thought of it as a video visit. And so what we do is similar to a video visit. We can help providers deliver care virtually. But the way that we do that is through a dynamic patient interview that a patient can start on their health system's website. So they go to their health system's website or their patient portal or their mobile app, really wherever they can start getting care. And they take about a 10 to 12 minute interview that uses the same kind of branching logic that a provider would use if they were in that traditional face-to-face setting. They ask them about, the interview will ask them about their symptoms, their medical history. Then we package that interview up, all the data about the patient that we learned through that interview process, and we send it to the provider in a chart note that's in easy to read format for the provider, something they're used to seeing, so that we can actually cut the time it takes to deliver care to that patient for those common low acuity conditions in about 3.5 minutes on average, and actually remove all of the clinical documentation work at the same time. So we can file that chart note once the provider's reviewed the assessment, the plan, the diagnosis. They can make changes to that if they disagree. It's really a clinical decision support tool in that way. They sign the chart note, it gets filed to the EMR, and the patient gets the after-visit summary in their email and any prescription sent to their pharmacy.
That being said, what are some of the misconceptions that people have about asynchronous care? You've already explained how it's similar to telehealth, yet different.
So one of the common misconceptions that we hear a lot is that the asynchronous interaction can't be as effective as an in-person one. Because of the lack of that real-time physical contact with the patient. But because these interviews are very consistent, we're asking, the interview dynamically changes based on how the patient answers the question, but we're consistently asking the questions in the same way. And these are very thorough clinical interviews. They take a patient 10 to 12 minutes to complete. They're evidence-based. And so it really mimics that history-taking process that typically occurs in that video visit or in-person setting. And so we actually hear from clinicians that in reality, unlike the myth, asynchronous interviews can be more comprehensive than what they really have the capacity to do in an in-person setting, because, those appointments are so packed together and they're trying to get through all that paperwork. We can actually kind of improve that. And so, patients are waiting less time, but they're also having a kind of more complete evidence-based interaction.
So what about workforce shortages? We've been experiencing this issue, before the pandemic, but especially once the pandemic hit. And even now we're experiencing shortages in the workforce in healthcare. How can asynchronous care options address that issue?
That's a great question. And something we think about a lot, because I think this is where I get really excited about, how this has the potential to really change, and improve a lot of the challenges that we're seeing in healthcare today. So, first off, burnout is a major driver that's causing providers to leave the workforce. And so one thing that we can do is really help providers be more efficient and remove that administrative burden that drives a lot of the burnout that's kind of driving them out of healthcare. And so we have a really high provider satisfaction rate because it's just, there's really no writing required for the provider. And that's a big difference. And then at the same time, with asynchronous care, I almost hesitate to say this because I think it sounds really overwhelming, but it's really not. A provider can treat upwards of 200 patients in a single day. And it's because of that automation that makes that really sustainable for providers. And so what we're doing is we're actually helping to remove a lot of the low acuity type of patients out of the healthcare system. So they have more time and capacity to see those patients in clinic that really need to be seen. So to kind of summarize a long-winded answer, we can kind of help reduce that burnout of the documentation they have to do. We can pull some of that volume out of the system with the patients that really don't need to come in and give them the time to focus on why they went into healthcare in the first place, those patients they really want to see and take care of.
In your experience, I heard you mention your client satisfaction rate. What are your clients actually saying? What is the actual feedback as a result of some of the benefits that you've seen from your customers? What are they actually saying to you?
Yeah. So a couple of customers, I can kind of call out some of the results that they've seen. We actually were at a conference recently with one of our customers, Presbyterian Healthcare Services, and they've seen actually that 43% of the asynchronous telehealth users avoided their emergency department and urgent care. And so one of the things we hear from their medical director is that the impact of Bright.md is really significant because, their emergency department, their urgent care clinics are seeing an increasing number of patients, as you can probably imagine with COVID and everything. And so being able, those 20,000 patients that took asynchronous visits through their through Bright.md would have created major delays in care. So they're avoiding those delays by reducing the volume of low acuity patients. And 43% is a pretty significant number.
Absolutely.
And then one other customer I'll mention too, actually a newer customer, Brett Oliver, who's the CMIO at Baptist Health, has kind of really taken on understanding another actual misconception about asynchronous care, which is, is this additive? Are patients coming back to see in person their doctor after they've had an asynchronous visit? And what he's found is 87% of patients who received asynchronous treatment through Bright.md didn't have to come in and see additional care for the same complaint. Excuse me, still early here. And so he's really talked a lot about the patient and provider satisfaction because of the thoroughness and consistency of those clinical interviews, and that they're actually seeing a reduction in time to deliver care, and it's really not additive. So that's another customer story we're really proud of.
Is there anything that you'd like to add, maybe a prediction for the future of asynchronous technology in healthcare, and then give us a website where we can learn more?
Absolutely. Yeah, I really got into this, not because of what we can do today, but what I think the applications are for asynchronous in the future. This is the question that gets me really excited because, right now we're focused on those conditions that we can treat fully asynchronously, but you can imagine this workflow could improve almost any clinical interaction. Things like pre-visit interviews, integration with remote patient monitoring, and really kind of rethinking how we're delivering care. So I think it's just the beginning, and I'm really excited to see what happens in the asynchronous care market, not just at Bright.md. But yes, for those that are interested in learning more, our website is www.bright.md.
Emily, it's been a pleasure speaking with you. I thank you for your time this morning. Hopefully we'll have an opportunity to speak again as asynchronous care progresses and becomes more widespread and mainstream. Thank you.
I hope so too. Thank you so much, Neil. It's been great.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Emily Goetz, VP of Commercial at Bright.md. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.